I'm Dr. Dusing.
Stu May. Nice to meet you,
Stuart, good
Doc.
to see you.
Stuart May has prostate cancer. He had his prostate removed, which got rid of the cancer for a while, but it looks like it's come back.
Do you know anything about PET scanning?
Very little, very
Okay.
little. I have had a couple PET scans done in the past.
Stuart is looking over his most recent scans with Dr. Reg Dusing, a radiologist from the University of Kansas Hospital. Doctors typically have a hard time accurately diagnosing prostate cancer, a disease just as common in men as breast cancer is in women. The diagnostic test for most cancers relies on injecting the patient with a safe radioactive compound before undergoing a scan. That compound lights up the screen, showing the cancer. But prostate cancer is such a slow-growing disease that traditional compound doesn't always show the recurrence. Now that's changed, thanks to Dr. Dusing's discovery of a new testing compound.
In the past, we weren't very good at finding it, so we didn't know how and where to treat it. So the revolutionary part about this is being able to identify exactly where the recurrence is and therefore affect a more precise treatment.
Dr. Dusing spent years perfecting the substance called 11C-acetate and recently published his findings in a scientific journal. It's great news for patients like Stuart, and thanks to this new test, which clearly shows the recurrence of cancer in multiple colors, Dr. Dusing was able to pinpoint the exact area for treatment.
It's incredible. You know, they told me that the carbon-11 scan would actually light up the cancer, and I had not seen the scans before, so when I sat down with Dr. Dusing, it's amazing. It literally lights it up and pinpoints exactly where the cancer is. And in my case, it was a bad news, good news. Bad news is the cancer's back. Good news is we found it just in one location, and it's something we can deal with.
We have now many patients who have been diagnosed, been treated, and gone back into remission. So it's pretty exciting, and I think will change the way that recurrent prostate cancer is treated.